was an issue with the chat box. Do you know if that's been fixed?
There's no issue with the chat box. The students can communicate with you at any time since you have been made co-host. And if they have any questions, you can, answer them whether you want on the chat or you can answer out loud for everyone to benefit. And yeah.
Couldn't access the chat box. It was not available. I can see it's available now, so that's good. But last lecture, it was a problem.
Okay.
So I guess we can start. So they're in the room?
Yeah, so there are many participants now. If you want to start, you can.
Yes, let's go ahead and start. So good morning, everyone. I just wanted to start off by kind of giving a bit of, let's say, info regarding just the exam. So we have supposedly, including this lecture, 4 left. I'm going to eliminate the last one, which is on memory, which is not yet uploaded on Moodle. Okay, so that will not be, I'm not going to upload it, so we're going to eliminate that lecture. So we have today learning, and then we have 2 more lectures. I'm going to try and finish them actually next Thursday because they're not long. They're, relatively short and easy topics, so I can finish off with you guys next Thursday. Now, regarding the project, so just let me give you guys an overview. I think over the past years, there's just been a general complaint that you guys don't have time with regards to this project. So this is a project that's given, you get grades because it's granted, like, it's something that you're going to write about. It's an individual assignment, so it's not like a group activity, so it's an individual assignment. I'm letting you know about it now. I mean, I've mentioned it at the beginning of the course, but it's not something that I could have given you much detail about, only because we need to have finished the course in order for me to actually give you the assignment, because you will then, choose from a list of topics that I will mention in an email that you guys will receive sometime next week. Okay, so I'm going to send you an email sometime next week with, very clear instructions about this assignment and with a list of topics that you choose from. But obviously, we need to have finished the curriculum in order for you to, choose from the topics that I will give you. I was just checking with the assessment office. So now I think your BHS exam is on May 4th. Okay. The submission date for this project or assignment is May 16th. Okay, so you guys have plenty of time, all right? Because I have to submit the final grades on the 18th of May, so May 16th is the deadline. It's not going to be difficult, and it's meant really to improve people's grades, those who have passed. If someone has, unfortunately, for whatever reason, not passed, this project cannot be used to pass them. I just want to make that very clear because it's been confusing for some. Okay, so this is something for those who want to improve their grade. It will improve their grade, but if someone has not passed, this is not going to be used to pass them. All right. So you will receive an email. It will be very clear, and I wish you the best of luck. So yeah, so next Thursday, we're going to be hopefully done. So then you have plenty of time as well to study. And I know, again, everybody's crammed. I received an email from one of you asking questions about last week's lecture. I'm going to respond to you. So I'm not, I didn't forget, but I'm just going to get around to responding to emails within this week, inshallah. Okay. So today we're going to talk about learning. It's probably as information that you may already know, because I'm sure you've studied this before, in school and maybe in university as well, like maybe over last year, just concepts that are not entirely new, but we're just putting it together because it's something that we kind of need to focus on. So what is learning? Okay, so we're born with inherent interest to learn. We learn with information given to us, but then there are things that we learn that no one's ever taught us, okay? So again, it's things that we've observed in our environment, behavior that we see, that we learn from. So learning is a very complex, let's say, skill, all right? And we observe, obviously, as we've studied about intellectual disability, so people with intellectual disability or any sort of injury to the brain will obviously have issues with learning, the degree of which depends on the degree of disability or injury. So basically it's a behavioral change, okay? And it's produced by repeated experiences of different situations. Now, I guess growing up, a lot of us, I mean, you may have heard from your mother, your father, your grandmother, it's, you know, it's practice makes perfect, okay? So the more you do things, the more you are better at doing them. And therefore there's a learning curve, all right? And so again, it just, again, reinforces the fact that it is a behavioral change. Because when you learn new concepts, you do things differently, you apply them differently, and so your behavior will change. Are there obstacles, do you guys think, to behavioral change? So you're given information. Is it really simple for people to just learn, change behavior, and move on? Do you guys think it's as easy as that? I hope the chat box is, okay, it's working. So it's not easy, all right? Why is it not easy? Why do you guys think it's not easy? Society, okay. Society, okay. I mean, changing behavior is actually one of the most difficult things to do. Concepts, skills can be hard to learn. So sometimes not only is it hard to learn, but there's also something called resistance, okay? We have a resistance to change, and it's not something that we may be conscious of, all right? So habits are hard to break. So again, resistance to change. So as much as we want to learn and change, there's an inherent resistance to change because, again, it's to preserve like status. Let me just see. Yeah, because you're used to it. So when we're used to something, it's hard to change. So I see kids with behavioral issues, all right? And we've talked about this before, you know, assessing behavior and kind of seeing what leads up to it, if there's a pattern, if there's a trend, and trying to change it. But that's because, you know, somebody has abnormal behavior. But let's say you are in an institute, you are in an office, and they want to change how they do business. Okay, now they're going to start doing something different in, you know, the process of work. So that is going to need to change. So people need to change in order to adjust or accommodate a new process. Again, so a lot of resistance initially because people are afraid of change. We're all afraid of new things. Some of us may be more rigid or inflexible. Some of us may be more spontaneous and more with the flow. So in any sort of community or organization, you're going to find a diversity. And so if you want to create change, you want to really hook with those that are promoting change. So those that are enthusiastic, but you also want to tackle those that are most resistant, because those are the ones that will create an obstacle for you. Okay, so if you want to create change, you have to deal with both ends of the spectrum, because if you only go with the spontaneous people who want to fly, this boat is not going to move forward because you're going to have people who are so resistant. Okay, and because again, change is new and it could be scary. Okay, so how do we learn? So we learn by association, all right, by observation. And so conditioning is really the process of learned association. So an association is when you connect things together. So when this happens, that happens, and so therefore you have an effect. And so you start to then understand, well, in order to get that effect, I need to have certain things happen. So you associate things together, and conditioning is the process, okay? So the building blocks of the learning theory are classical and operant conditioning. And classical conditioning is something that we all took in school, okay? We'll talk about that in a second. So classical conditioning is when you learn to associate two stimuli. So two stimuli are associated together, and then you anticipate events. Operant conditioning, you learn to associate a response and its consequences. So you have something happen, and then what are the consequences of that? And then observational learning is obviously from other people's experience. So this is, like, how do you observe in the world? Interestingly, there's, I've met people where they don't really pay much attention to what's going on around them. And there are people who pay super much attention to, what's going on around them. Okay, somebody's asking. Yeah, so Pavlovian is the classical, and we're going to talk about that in a second. Okay, so again, this is for you to reflect upon yourselves. Are you somebody who tends to observe in their environment? Do you like pay attention to detail? Or are you somebody who's very like super focused on what you're doing, and kind of like, the world around you may not be as interesting to you, so people vary. Okay. So classical conditioning. So Pavlov, so we've all taken this in school, I believe, right? So how does a neutral stimulus become something that's conditioned, right? So I'm going to walk you through it. You know it, I'm sure, but let's just go through it. So obviously, when you put food in a dog's mouth, it causes salivation. So this is instinctual. It's not something that's learned, okay? So a neutral stimulus does not produce salivation, okay? But if you pair it with food, it will produce salivation. So if you ring a bell and the dog is there, it doesn't mean anything to the dog, the fact that you are ringing the bell, because it's not paired with anything. However, when you pair the bell with food, okay, and it's the food that's producing the salivation, which is really an unconditioned response, you start to have an association. So therefore, when you sound the bell without the food, you then produce salivation, okay? So starting off with something that's neutral, which is the bell, you pair it with something that will cause a response, and then eventually this pairing will produce the response that you want, okay? So before you condition, before any kind of intervention, food is an unconditioned stimulus, and it produces salivation, which is an unconditioned response. This is an instinct, okay? However, you have the bell, which is a neutral stimulus, okay? It doesn't really mean anything yet to the dog. You start to pair it with food, okay? Where food obviously causes salivation. With the repetition of this process, so you kind of repeat, you ring the bell, you give the food. So with repetition and underlying repetition, okay, then you develop conditioning. Then when you sound the bell, which is now a conditioned stimulus, it will produce salivation, which is now a conditioned response. Is this clear? Does anyone have an issue with this before we move on? Okay, so the idea is, again, it's learning. You learn that when you hear the sound, something is going to come with it. So that's a learned process. And in order to do that, you need to repeat it. It's not going to be from one time, okay? It's not a one-timer. So can you repeat this, someone says? All right, so when you give food to a dog, it salivates, okay? That's an instinct. Here, the food is not a conditioned stimulus. It's just, it is a neutral stimulus in a way that, when you give food, an automatic thing that happens is there's salivation. So this is a biological, you kind of build on existing instinctual biological sort of things. You're not creating from scratch, all right? Then what you do is you pair, like you bring together a neutral stimulus, because whenever you sounded the bell before, this dog would not salivate because there's no connection, all right? The dog has not formed a connection yet between the bell and food. You then teach the dog the connection. So you ring the bell and you give them food, all right? And the food causes salivation because that's a biological thing, right? So what happens is that now every time you pair the bell, you ring the bell, you give them food. So then there's an anticipation. So when the dog hears the bell, they're going to anticipate that food is coming. And so there's an automatic kind of salivation in apprehension of food coming. All right. So then every time you ring the bell, you do get salivation because there's an apprehension, there's an anticipation. You've already created this association, you've created a connection, you've taught the dog that when you hear the bell, there's going to be food coming, okay? So the conditioning process, there's kind of like a number of things that happen, okay? I'm going to list them here and then I'm going to explain them. So there's something called acquisition, there's extinction, there's spontaneous recovery, generalization, and discrimination. Now, the value of knowing these things is how it then ties into, you know, our behavior as humans, right? Why do we associate things in particular with other things, and why do we avoid things? So we'll talk about that in a second. So the initial stage, again, acquisition, when you link a neutral stimulus to an unconditioned stimulus, all right? So that the neutral stimulus starts to trigger a conditioned response. For example, when you are puffing air, like you're sitting in front of someone and you're just puffing air, it doesn't mean anything. But when you start to puff air into their face, what is the automatic response? They're going to blink because, you know, you're kind of putting something in someone's face. And so when you puff air in someone's face, the automatic response is they're going to blink, okay? So if you do that repeatedly, all right, then what happens is when you puff air, even when you're not close to the person, their eyes are going to blink, okay? So this air puff that was generally a neutral stimulus, it didn't really mean anything, all right? It started to mean something when you paired it with a response. So then it becomes a conditioned response. And here you can think about like fear, right? When you tell a child, you know, you start to pair something that didn't really mean anything to them, and you start to give it an association. And so this is how fear develops, all right? So a child sees a cockroach. Cockroach doesn't really mean anything to them, like a 3-year-old. But then the 3-year-old sees how their mother responds to that cockroach. So cockroach comes in, mom is screaming and jumping. So they start to make that association, although they don't initially feel that fear because that cockroach didn't really do much to them. Then that association becomes transferred. So this, again, would probably be more of a learning by observation. But then when this child sees the cockroach, then they start to have the same kind of fear where they want to, you know, jump on a chair or kind of run away, but they don't know why, okay? All they know is that that's how they saw it and that's kind of what they believe. So associations obviously are going to influence attitude and behavior, okay? But if you become aware of this association, how does that affect your likes and dislikes? So for example, you walk down a particular street and there's always a smell of a bakery. You don't know that there's a bakery there. You've never seen a bakery. It could be somebody cooking from their window, but every time you pass, you know, it smells of something baking, or it smells of flowers. So you're more than inclined to use that route because of the nice smell versus, you know, walking down an alley that really stinks. And so then you're like, I'm not taking that street. It just always stinks. So you formed an association between a place and a feeling or a sense. And so that will obviously kind of affect your behavior and attitude because you've formed that association. Obviously, you know, that's a simple thing, whether you choose to take a street or not take a street, it's not really going to affect your life. But if you start to form an association between a panic attack and an airplane, so the first time you get a panic attack was on an airplane, And that's where you form the association. So what happens is people start to avoid getting on airplanes, getting in cars, being in social situations, because that's where they get their panic attack, is inside, in a mall, for example. So these associations will then affect, for sure, our behavior. Okay, so extinction and spontaneous recovery. So what happens when someone keeps sounding the bell, all right, without presenting the food? So you sound the bell and there's salivation, and then you keep sounding the bell and there's salivation. So what do you think is going to happen to the salivation? Is it going to continue with the same extent? Is it going to start getting less? Is it going to stop? So it's going to diminish eventually to decrease, okay? Because, there's this anticipation, but then nothing happens, all right? So the salivation is going to get less. It starts to get less, okay? And that's called extinction. And so then if after hours, you kind of then suddenly sound the bell again, there's something called spontaneous recovery, and that's the appearance of a very weak conditioned response after a pause, okay? So this is kind of a process, right? But again, with time, if you don't sound the bell, then this animal will forget the association, all right? And so therefore, whatever was learned is not learned. And so you have to kind of retrain or sort of reinstitute this process. So when you're working with animals and you're teaching them how to do a trick, okay? And so part of it is they learn that when they see the food, they do the trick. But then if you again show like make the sound but not present the food, eventually they're not going to be very interactive with you, okay? So this is what happens again, is extinction and spontaneous recovery. The next is generalization. So here it's a tendency to respond to stimuli that are very similar to the conditioned stimulus, okay? So for example, if the dog is conditioned to respond to a bell, they may also respond to a tuning fork because it kind of sounds the same, okay? So it can also explain how people can learn similarities. So you can be afraid of, let's say a child is afraid of the honk of a car because it's scary to them because of an incident, for example. But then any other sound that sounds like it can cause the same kind of response, okay? And it can be adaptive in the sense that, you kind of generalize. You can be afraid of a dog, a small dog, but then because, or for example, more commonly, people are more afraid of like bigger dogs, okay, large dogs, because it looks scary or you don't know what it's going to do. And so if you have anxiety, it becomes generalized to pretty much all dogs and maybe all pets, okay? So there's that generalization because they are similar, okay? The discrimination is a learned ability to distinguish between a conditioned stimulus and other irrelevant stimuli. So here you respond differently between similar stimuli. So maybe I'm afraid of dogs, but I'm not afraid of cats, although they are pretty much four-legged, because dogs seem scarier to me, cats seem more benign. So you discriminate in terms of what causes this stimulus, because one is more relevant and one is more irrelevant. So what are some applications of classical conditioning? Okay, so people who are, again, in the area of substance abuse, whether alcohol, drugs, substances in general, when they get into like Alcoholics Anonymous or Narcotics Anonymous, like these, support groups, one of the main things they tell them is they have to avoid settings that trigger craving, okay? So avoiding certain people that they used to, drink with or do drugs with, avoid places, avoid things that, help or pair the association. Does discrimination also develop at the end of the sensory motor stage, obviously you need to have, reached that stage. So again, it's a cognitive process. So yes, after the age of 2, where you're able to kind of distinguish between things, and so that's when it would apply. So with classical conditioning, again, it's really important. I mean, that's the clinical application of, because you've formed association between certain people and certain places, and the substance of abuse. So if you see the people or you go to the places, then there's the craving that's triggered. And so what was already extinct as a stimulus becomes, you have a bit of a spontaneous recovery, because now you have the craving. So now you remember, these are the people, those are the places, and so you remember the experience. And so that's a clinical application of classical conditioning. The other one is a story about little Albert, who was sort of a 12-month-old, so about a year-old child, who was not ever afraid of rats, because rats don't really mean anything to that child. But what happened is that they started, this was an experiment, and obviously it was not a very ethical one. And I think there was allegations, if you read up on it, on little Albert. But what happened is that they would pair, whenever the white rat would come in, they'd produce a very strong, disturbing sound, which alarmed the child, okay? So therefore, the rat would come in, they would pair it with the noise, all right? And so eventually the rat, which was not a conditioned stimulus, it was a neutral stimulus, but by being paired with this very disturbing sound, it became a conditioned stimulus. And so every time the rat would come in, even if there was no sound, the child would cry, okay? So this is how you instill fear, is when you pair something that was completely neutral to something that was quite, that is disturbing, whether it's a sound or sort of something that's painful. So something that's aversive, if it's connected with what something that's neutral, then you're going to have a negative response. So this is not something that we would ever want to, try with kids or people. All right, so now moving on to operant conditioning. So organisms usually associate their actions with consequences, okay? So behaviors are linked to consequence. So if something is followed by a reinforcer, what will happen to this action? So if every time you do well, you're given a present, what does that do to your behavior? Does it increase this behavior or reduce this behavior? So it obviously increases, right? Does it get to a point, do you think, where it doesn't matter anymore? Do you think, like, if you do things and you're given reinforcers that are, usually positive, do you think it gets to a point where it doesn't matter anymore? So it increases, but then diminishes. And why do you think that is? Why do you think that happens? Yeah, so it becomes an expectation. And because generally we get bored, right? People get bored. And so it doesn't really, so it's not really as exciting as it used to be anymore. So if every time you score A, your parents award you with something, eventually it's not about the award, it's more about your own internal motivator to score. But again, with regards to behavior in children, for example, if every time they clean up, you give them a sticker, okay, so they've collected 100 stickers, and then so what next? So there's an expectation of more, as well as just, it just becomes neutralized. What about actions that are followed by punishers? So if you do a certain behavior and you're punished for it, what does that do to your behavior? So it decreases the behavior. So this is kind of like the very basic, it stops the behavior, okay? So you kind of avoid the behavior. So this is the very basics of behavioral modification, right? It's as simple as that in terms of the basics, okay? Okay, so it depends on the child. If they're rebellious, they would do the opposite. So we could apply this again to anything and anyone. So generally, I know I tend to kind of like drift to kids, but you know, for any kind of behavioral change in adults and children, the basics of it, if you want to increase a behavior, add reinforcers. If you want to reduce a behavior, you know, put in some punishers. So that's kind of the basics of it. All right. So Skinner's experiment, okay, is an experiment where there's something called an operant chamber, Skinner's box, okay. Basically, what they did was they had little rats in a box, and so every time they would do a certain thing, they were rewarded by food, okay. So when they did a certain behavior and they would tap, so they would get food. And so that would increase their likelihood of doing the desired behavior. And this is the basics of, you know, training. If you want to train, you know, an animal to do a certain trick, they do it and you feed them, you know, you give them the reward. And so that increases that behavior, okay? Again, I'm going to talk about kids. We do that with children. Like, you know, if you do that, you give them an M&M, and so they'll more likely do that. Or you give them a sticker, and they're more going to likely do that. So these are things that will sort of increase a particular behavior. So then they looked at types of reinforcers. So any event that increases the frequency of a preceding response is called a reinforcer. So we have two types. We have a positive and we have a negative. So a positive reinforcer is obviously adding a desirable stimulus. So when you do something, you're given something positive, so you're given a reward. But what about a negative reinforcer? What does that mean? Or what is that, like, how could it be negative and be a reinforcer? So we're not talking about punishment here, we're talking about reinforcers, okay? Because a punisher is not a reinforcer. So you achieve something, but the reaction is not as great. But then we're talking about a reinforcer. So a negative reinforcer, so a positive one is where you add a desirable stimulus, but a negative one is where you remove an aversive stimulus, okay? So that is a negative reinforcer. An aversive stimulus would be, an example would be when you ride in your car, if you don't put the seatbelt, okay, there's that sound, right? The sound that is really irritating. So in order to remove that aversive stimulus, you put your seatbelt. So that is called a negative reinforcer, because at the end of the day, you are going to do a desirable behavior, which is put your seatbelt on. Another example, like you don't clean up your room and your mom is like nagging and, you know, all the time. So that's not a very pleasant stimulus. That's actually an aversive stimulus. So what ends up happening is that you clean up your room. So when you clean up your room, mom stops kind of yelling or screaming. And so therefore that's a negative reinforcement, okay? So there's the types of then are the kind of primary, which is an unlearned, okay? So, you know, you put food and it's kind of not something that you learn it. It's a primary reinforcer. Or you have a conditioned one where you have a sort of a learned association. So sometimes events happen, okay, that are reinforcers, but they're not sort of planned, or they're not kind of reinforcers that are repetitive. Whereas a conditioned one is where you start to associate things with each other, okay? So conditioned reinforcers are ones that are more likely to have sustained behavior, okay? And we'll talk about that. And it depends on, sorry. It depends on the schedules of reinforcement that you use. So you can have either a continuous reinforcement schedule or a partial intermittent one. So the continuous one is where every time something happens that's positive, you reward it. Whereas the partial is sometimes you will respond and sometimes you will not. So some responses may be reinforced, some may not. Okay. So we look at partial reinforcement because there is a belief that, again, based on research and a clinical experience, that if something is partially reinforced, it's more likely to continue than something that's continuously reinforced. Remember when I asked you the question of if you always kind of reward people, always, does the behavior continue to, will the positive behavior continue? And some of you said it diminishes because there is an expectation, because it's continuous. So when you apply partial reinforcement, okay, what happens is that you actually are more likely to have a sustained response. Okay. So what do you mean that responses are reinforced? So a reinforcement is like a reward. Okay, so a response that happens and then you are rewarded for that, that only reinforces the behavior. So you clean up your room and your mom gives you extra time on PlayStation, for example. So that is a positive reinforcer. So therefore, every time you clean your room, you're going to get time on your PlayStation. So the likelihood of you continuing to clean your room is high, because the reward that you are getting is something that you actually like. Okay. So with partial reinforcement, there's sort of four fixed interval and a variable interval. So the fixed ratio schedule is a reinforcer after a set number of responses. So an example is you go to Starbucks and they give you every 6 coffee, you get your 7th for free. So that's a fixed ratio. So you know that after every 6 coffees you buy, the 7th will be free. Okay. A variable ratio schedule, all right, is the example that is given is like, you know, the slot machines. So it's unpredictable. When are you gonna like receive the coins? So that makes you more likely to play because it's not predictable, right? And so the reinforcer being unpredictable only reinforces the behavior. So people are more likely to sit on that slot machine, put in more coins, because it could be the first time that you get the coins or after the 4th time. And because it's so unpredictable, you're more excited, and so you're more likely to sustain the behavior. A fixed interval schedule is when you get a reinforcer, it reinforces the first response after a fixed time period. So the example here is like the salary, right? So we get our salaries at the end of the month or middle of the month or whenever, depending on, you know, where you work. And so, for example, like where I'm working, there's the ATM machine in the main lobby. So I know that it's salary time without looking at the date is when I see a lineup in front of the ATM machine, because it's a fixed time. It's a time of month where people are going to get paid. The variable interval schedule is, again, when you don't have a time interval that's fixed. So for example, your email, all right? Your messages. So these are things that are not fixed. And so you're more likely to be checking your phone, you know, because you want to see, did I get an email? Did I not get an email? Did I get a message? Did I not get a message? So as you can see, variable interval and variable ratio, okay, are more likely to sustain a behavior. And these behaviors can be more of the addictive ones. So people have, like, you know, when it's really hard to put down your phone because you're anticipating, okay? So that's why people are on their phone, you know, a lot of the time, because again, these things are not fixed. So when we're looking at creating a behavioral program for a patient, all right, with any sort of behavioral issue, you want to look at how are you going to sustain it. And usually things that are not continuous, so more intermittent, not predictable, and then having a variable sort of ratio variable interval. So that makes it more kind of exciting for the person, and so you can, you know, gauge them more. Okay, because again, we get bored and there's the expectation. Okay, so does stopping a positive reinforcement for a period of time prevent the behavior from diminishing with time? So I'm trying to understand, prevent the behavior. So that means like if you stop rewarding someone, are they going to stop eventually, you know, doing the good thing? Is that what you mean when you say stopping a positive reinforcement? It really depends on the behavior, and it depends on the condition, right, that you're dealing with. So let's say I'm creating a behavioral program for a child because I want them to, parents complain that, you know, they're not brushing their teeth, they're not changing their clothes when they come home from school. They run to play with their whatever PlayStation or whatnot. So the behavioral program would be that you put in these positive reinforcers, and then you are going to master a particular behavior. It's expected that when you stop the positive reinforcement, that this behavior will, you know, diminish somewhat. Okay, and then you need to reinstall again the positive reinforcement. But again, you cannot have someone on a schedule forever, because that's just unreal. Okay, but what happens is when things get into the kind of schedule of the person, it could be more of a habit, you know, like waking up and brushing your teeth, washing your face, and even with salah, it becomes more of a habit for people. Okay, and so not something that you will need to do like these positive reinforcements over time. So which one would you prescribe? One or all? I think, again, these programs are very holistic, so you are going to try different things and see how they work. And again, it depends on the problem that you're dealing with. How does punishment affect behavior? What do you guys think? Does punishment always abolish behavior? Does punishment make behavior worse? What do you guys think? Do we need punishment? Okay. So yes, we need punishment. Depends on frequency or severity. It can be good or bad, increase or decrease. So again, it's kind of like a diverse area, many opinions. Okay. Okay, what's the one system that we have where punishment is absolute? It's absolutely necessary. Like there's no question about it. Punishment is, yeah, so law, okay? So the law is absolute punishment. So if you kill someone, you know, there has to be punishment. So there are certain behaviors where there has to be absolute management, because again, it's not okay to, like, you know, go around and harm people. If you're going to abuse people, there has to be punished. So there's certain behaviors where punishment is absolute, but these punishments are available, like readily known to people. So it's no surprise that if you kill someone, you're going to be, you know, in prison and kind of go through the law system. It's not like news. It's something that people know. All right. So even when you are going to punish someone, let's say for trivial behavior, okay, it's important that that is also known to them. So if you're in a workplace, so people need to know the penalty of not signing in on time. It has to be in a policy of the organization. So they do have these policies of, you know, misconduct, you name it. So these things are readily available to people so that they know. It's really not fair to someone who doesn't know your system and then not told, and then you suddenly throw this at them because they didn't know, right? So when you work again with behavioral programs, these things are told to people, like, if you don't do this, then that's going to happen. I mean, we've all had that happen to us as kids growing up. You know, your parents tell you, if you come late, you're going to be punished. There is a curfew. If you hit your siblings, this is going to happen to you. You know, it's not kind of sprung upon you. So, you know, your parents tell you these things. If you steal, if you lie, you know, this will happen to you. So there's consequences to these behaviors. And then people are told that if you do this, that will happen. Then it becomes your choice. You know, if you know that coming late is going to be punished, you're going to be punished and grounded, and then you choose to come late, all right, then obviously you deserve what happens. You deserve what comes to you. Now, the interesting thing is how people kind of, let's say, maneuver around that. So if you know that when I come in late, I have a parent that I can kind of plead with and beg, and eventually that punishment of you're grounded for a month will always change. Okay, so if I know that there's a loophole, then obviously it's going to affect my behavior in the sense that I will come in late, because, you know, whether I come in late or I don't come in late, I still can get my way, right? So if you know that when you go to work, the rules of punching in and punching out are not strict, then obviously people are not really going to come in on time. Okay, so when you set a rule, okay, or a kind of consequence, you have to follow through. All right, so I tell parents, when you say that someone's going to be grounded, all right, so if they beg, plead, cry, no matter what they do, saying sorry is not going to kind of delete the punishment, because that's really what happens with a lot of parents is, you know, once the kids say I'm sorry, then the mom will say, well, he said he's sorry. And I'm like, yeah, well, he said his sorry today and he said his sorry last week. It was all around the same behavior. So in order for you to change it, then, you know, sorry really doesn't cut it. Okay, it doesn't mean that we don't acknowledge the apology. So you say thank you for apologizing and thank you for, you know, acknowledging that you've done something wrong, but, you know, you're still grounded. So that's really how you can instill a change in the behavior. Okay, so a punisher is any consequence that decreases the frequency of a preceding behavior. And it's, again, positive by adding an aversive stimulus where, you know, example would be like you hit someone or you kind of ground them or something like that. And negative is when you remove, sorry, the grounding someone is when you remove a desirable stimulus. So you ground them, you take away their privileges, they don't go out on the weekend. So that's a negative punisher. Positive is when you say aversive, it's more like when you hit them or, you know, lock them up or something. So here, you know, like jail or prison. So here you're adding an aversive stimulus. You're locking that person up, okay? Which of these do you think has better outcome? Adding an aversive stimulus or removing a desirable one? Which do you think is more appealing? Obviously, it depends on the behavior. Like if someone does something that's outrageous, then. So the negative, an aversive stimulus is something that's not pleasant. So if you hit someone or if you know, do something that's really negative to them, that's aversive. So it's usually something that causes pain. Okay. So punished behavior, all right, can be suppressed. Okay. Sometimes punishment, again, these are like some of the negative aspects of punishment. Sometimes when you punish overly and for anything and everything, you lose the value. So if you're going to ground someone for anything, or if you're going to suspend someone for everything, it loses its value, right? If your mom yells at you all the time, you know, there's no value to her yelling anymore. It becomes something that doesn't really mean anything, okay? Punishment can also teach discrimination because you kind of single people out. It can teach fear. It can increase aggression. So hitting people obviously can increase their aggression because, you know, that's kind of the learned mechanism. I had a patient yesterday. She's an autistic girl, and she lashes out. You know, again, her mood is very unstable. So I'm not saying that she's aggressive because she's autistic. She's aggressive because she has mood instability. All right. So because of her mood instability, and she lashes out in a very unpredictable way. So we've talked to her parents about, like, what are the trends, what are the pattern. Are there things that kind of, remember when we talked about antecedents? So are there things that lead up to her being aggressive? And there is no pattern. So it's really her mood instability. Okay. And that's really one of the most difficult to manage, because it just hits you out of nowhere. So yesterday, mom's question was, when she hits me, she's like, I'll be sitting, and then this girl just slaps her out of nowhere. And she's like, 13, 14. And so it's not like a tiny slap. It is a slap, okay? She says, I automatically slap her back. It's kind of like an unconditioned, it's become a conditioned response actually for this mom. When the girl hits, mom hits back, okay? It's because she says it happens a lot and it hurts. So her question is, should I continue doing that? When she hits me, should I just hit her back? What do you think the best answer, or what would be a good answer to her? And if I say yes, continue to hit her, what would be the logic? If I say no, do not, what would be the logic? So therapy, don't talk to her. Okay, so we're talking about an intellectually disabled autistic young girl, all right, who is, her mood is not stable, and that's one of the reasons she lashes out. Okay, so she's not going to really understand, don't hit your mother. The mother is asking me, if she hits me, should I just hit her back? Okay. So the answer is, do not hit her back. Okay. Because when you hit her back, at some level, she will connect or associate that is how we communicate. So if I hit, they hit, that becomes our mode of communication. So what I told her is that, when she's hitting you, it's not because she wants to, it's because it's really related to her instability, the mood instability. So sometimes just explaining to people why certain behaviors could possibly happen kind of takes away from their anger and frustration. So this girl is hitting you not because she wants to, but because it's either a way of communication of something, because she doesn't have language, or because her mood is so unstable. So what I told her to do is not hit. I told her, hold her hand forcefully, but don't like break her hand. Hold her hand forcefully, all right, and say no, all right? And like make sure you have eye contact and say no, and put her hand down, right? Now, how do we stop this daughter is we are, treating her mood instability. So she, we started her on medications to help regulate her mood because, that's really the reason. But until that happens, until her mood is a bit more stable, where we anticipate that, hopefully this aggression will subside. How do you teach toddlers not to hit? Okay, we're going to talk about that in a bit when we look at learning by observation. So again, punishment has its positives, obviously, when it's in the legal system where it is an absolute, there's certain things you have to punish, but also like in dealing with your kids, when children are swearing, when they're aggressively hitting, okay, so these things are not acceptable. These are not acceptable behaviors because they are harmful, they are dangerous. This is where you can actually, do more of the punishment because it's quite dangerous. So punishment here would be not aversive stimulus. I'm not going to beat them up, but I'm going to ground them. So when they hit or when they are aggressive, they're going to be grounded. So you're kind of removing desirable stimuli. So that is a punishment, all right? More likely than, if you don't swear, I'm going to reward you. It shouldn't be that way, right? So we're not going to reward people for stopping really aversive behavior, right? So you have to kind of tailor it depending on the behavior that you're dealing with, okay? So there is a positive side to it, but also a negative side. So some of the applications of operant conditioning, because we've talked about like the clinical application of classical conditioning, but what about operant conditioning, where, you know, behaviors are associated with a consequence. So this obviously happens in the sports world, because the more you achieve, so you got the silver or bronze, now you want the silver, now you want the gold, okay, because there is a reward in that area, it pushes people to kind of let's say excel, as well as in the workplace, bonuses, you know, the employee of the month, you know, being promoted. So these kind of things really help in these environments. You know, that's the application of operant conditioning in your life. Okay, when you have a goal, let's say you state your goal, you want to graduate with a 4 out of 4 GPA, inshallah. All right, you monitor often how you engage in your desired behaviors. So you kind of monitor, okay, in order for me to get that 4 out of 4, I need to do the following. All right, often you're going to reinforce this. It's reinforced because obviously you're going to be getting the grades. All right, but again, when you say the reducing the rewards gradually, because there's a lot of the self-motivation that happens. A lot of us will do things not because you want to get like someone to kind of say, hey, you did a great job, but because of your own sort of self motivation of yourself. I mean, we don't always need external motivators. We don't always need recognition or somebody to kind of give you the award. The more you have that internal system going for you, the more you're going to be like reaching your goal for yourself, not for anyone else. Okay, this could also be with, let's say, you know, reaching your ideal weight, reaching your ideal like muscle mass, reaching your ideal in terms of a relationship. So again, in order to reach where I am, how do I motivate myself? How do I reward myself? And do I always need a reward system? Again, you know, in some things, it's just not possible. Like even at work, you know, how many times can you get promoted? Let's say I'm promoted like once. Am I going to always be promoted? No, I'm not, because there's other employees. So if other employees are also going to get a chance, does it mean that I'm not going to put the same effort just because I got promoted once? Well, obviously not, because, you know, you need to have your own sort of internal kind of system going for you. Okay. So learning by observation, and this one is interesting because, again, it has a lot to do with you as a person. Are you somebody who tends to observe or not? And you may have heard from your parents, you know, well, didn't you see what happened to whoever? Why didn't you learn by, you know, just, you know, seeing what happened to other people? So sometimes it needs to happen to you. It has to be a personalized experience for you to learn. Some of us are like that. Your parents will come and tell you about, you know, the do's and don'ts of life based on their experience. They kind of give it to you on a plate of gold, but do we take their advice? No, we don't, you know, but then we have to go through our own learning process. And then eventually come to the same conclusion of, oh, they did tell me this, and, you know, I wish I listened. But again, that's learning by observation. So it's kind of the imitation of others. It's role modeling, okay? So when a 13-year-old comes and tells me, I hate it when my 6-year-old just copies me in everything, or you feel like so bothered that your, you know, your younger sibling is like you're a mirror, they're like copying you. So it's because you're a role model, okay? And so there are like, you know, I don't know if you ever heard of like Big Brothers or Big Sisters. So these are organizations where, you know, older, more mature, you know, teens or young adults become role models for younger people who may not have a role model. Okay, it's really important to have someone to look up to. It could be your father, your mother, whoever, but, you know, somebody to look up to. And if sometimes people don't have them in their life, they look up to, you know, a particular actor or a leader. Okay, so this is learning by just looking up to your role model. And we talk about mirrors in the brain. So Bandura's experiment, for the person who was asking, how do you teach toddlers not to hit, okay? We'll talk about that. So observational learning. So modeling is a very good pro-social behavior, okay? So when you have a good role model, by default, you start to do good things. It's not that they told you do this or don't do that. You just see it. So you see that, let's say your mom or your dad or your best friend, you know, the way that they manage things is just, you like it, okay? And so you kind of start to kind of imitate. It's hard for someone to not lie if their role model is lying. So, you know, the classical example, you know, phone rings, mobile rings, let's say, and you pick it up and someone, it's your dad's mobile and somebody wants your dad, and your dad's sitting right there, and then, you know, somebody wants to talk to them and dad's like, you know, tell them I'm not here. So that's not a good, not good modeling, okay? People do it all the time. But you can imagine that if you have these kids that are looking up to you as a parent, it's really important to be that role model, because it's learning by observation. So when parents bring in a child who's using foul language, right? And the mom's like, we don't know where this kid got this language from. Like they don't actually notice. And in their interaction with each other, I noticed some foul language. So I pointed out, and I say, I'm wondering if, you know, maybe it's just things that they're hearing, maybe the way you're addressing this person, this child, that's how they've learned it. So it's important to observe your behavior, because people around you will learn from you, okay? What about the antisocial effects of TV and media? What about, you know, looking at violence on, you know, whether it's TV or, you know, all these games? What do you guys think about that? Do you think it has, you know, a very strong impact on people when there's all of that antisocial kind of effects? And is it a direct thing, do you think? So it's very strong. It's you know, on some people, yes, okay. It's very subtle and subliminal, okay. So the more violence you watch, your threshold actually is going to go lower, okay. So if you had a high threshold, it eventually is, you're desensitized. So there's a lot of desensitization that happens depending on what we're looking at visually or like what we're hearing. So there's a huge impact on us just by observation. Things that we see, things that we hear, we learn indirectly, okay? So when a child watches aggressive movies, can he become violent then? Okay, it's a really good question, because I get asked that a lot by parents. People tend to relate more to characters that they see that match their identity. It's hard to relate and follow who has no similarity to you, but if they present it as heroes. But you know, sometimes you look for what you don't have, okay? Sometimes when you look up to people, it's because you aspire to be like them. You are not a very social person, and you look and you're like, and you meet somebody who's super social, and you're like, oh, I wish I was like that, okay? I wish I could learn to be that way. So we generally tend to like identify with the things that we don't have, okay? I don't know if you guys agree with me or not, but I feel that that's what happens is, it's just, you kind of look for what you don't have because you aspire to be, and that's where you kind of learn. Your role model is not going to be a criminal unless, again, you're kind of fascinated by how intelligent they are, so that your fascination with them is not their criminal kind of part, but it's just how intelligent. It doesn't mean that you're not intelligent, but I mean that's what kind of struck you, but that's not going to be your role model, okay? Role models are kind of more holistic people who have a lot of positive traits. So someone says, yeah, when you watch things that are really disturbing over time, they don't become as disturbing because you're desensitized. Okay, so if you're afraid of rats, the more rats you see, and we call that flooding. So you kind of treat these very specific phobias by flooding. So I put you in a room with rats, you're gonna scream your brains out, but eventually, you know, you're gonna be so anxious that then it's gonna be desensitized. I'm giving you the extreme form. We don't really do that anymore, but I mean, you know, that is a mechanism where, you know, when you have extreme desensitization to the point where you're not affected anymore. Okay, so the impact of social media is essential on all of us. So we really have to be careful, especially if you have like young viewers, and you know, what is it that they're watching, and you know, that's just very important to take care of. Okay. Do you think that violent video games used to do the same? I used to think that, but I heard someone say it's an outlet for people to get their anger, frustration, so they don't do it in their physical life. You know what? It's a hard one to comment on because it's so variable. We're going to talk about aggression and violence in next week. So you have like certain kind of prerequisites, if you will, in certain characters that kind of predict violence, all right? But like I said, the fact that you don't, I mean, just that your threshold is kind of lowered. And again, I would say that it's good to have diversity. So, you know, if kids are going to be playing or adults are going to be playing games, let it not all be in the same kind of area, because, you know, just watching violence all the time, it could kind of wire you. There are other ways of letting out anger and frustration in healthier ways. So sports, meditation. So those kind of things are much healthier in terms of letting out anger and frustration rather than engaging in, you know, violent video games. Again, I'm not against that. I'm just saying balance. So I just believe that everything is about how much you do of whatever you do. If you have things that are evenly balanced out, then you're fine. But if you're like hyper focused in a particular area, you know, not sure if that's going to be entirely, you know, healthy. And I've seen like kids where we, you know, who have difficulty sleeping or who are, you know, tend to be on the more aggressive side. When we reduce the number of hours that they're on playing online games or video games and increase maybe the other kind of gadget related activities, things balance out. Okay, because it's really hard to tell a kid, you know what, no more video games. That's just not a very logical. But you say, you know, like have a balance. Okay, that is it for today. It's not as difficult. So what I'm going to do is I'm going to be sending you the email, like I said. I just received from the assessment office a message. They prefer that you guys submit by the 13th of May. Okay, I'm going to just arrange with them. So we're between the 13th and the 16th. So maybe we'll go to the 14th or 15th, but I will give you the definite date because I don't want to also push the assessment office in their time. Inshallah, you have plenty of time from I don't know when your last exam is going to be, but from the 4th of May till whatever, the 13th or 14th, so you're going to have like 10 days. And it's just an essay that you have to write. The 6th is your last. Okay, so yeah, you're going to have like probably a good at least 8 days. And trust me, this will not take you more than an hour. Okay, if you sit for an hour of your time, that's all it's going to take to finish this assignment. Okay, because I don't want to take from the last 10 days of Ramadan and, you know, your worship hours, but it's just going to take you an hour. All right, thank you all so much. Have a great weekend.